Right. In this session, we'll see about a role of other organs in excretion. Right. So here, not just the kidneys will help in the elimination of excretory wastes. There are other organs in our body that also help in eliminating the excretory wastes. So, for example, so the other organs that play a role in the elimination of waste materials will include lungs, then liver, and then skin. So these are different organs that actually help in elimination of waste material. So first we will see about the lungs. So in the case of lungs, these lungs will eliminate large amounts of carbon dioxide. So eliminate large amounts of carbon dioxide. So that may be around 18 liters of carbon dioxide per day. So 18 liters of carbon dioxide per day will be released. Then the lungs also will help in losing water every day. So they remove significant quantities of water every day. Okay, significant quantities of water is also lost. So this is how the lungs play a role in elimination of carbon dioxide and water loss. Then coming to the liver actually it produces bile. Okay, so only a small part of the bile is useful. The rest is actually contains a lot of waste materials. So this bile will contain substances like bilirubin. So it contains bilirubin. Then it consists of biliveridin. So so this bilirubin and biliveridin both are the products produced during the breakdown of RBC. So products produced during breakdown of RBC, right? And they're of no use. They have to be eliminated. Then the cholesterol, extra cholesterol, whatever, okay, that also will be well eliminated. Then there will be degraded steroidal substances, okay, and then excess vitamins and even drugs. So all these will be present in the bile and they will be released into the alimentary canal, and through the fecal matter they get eliminated. So this is in the case of liver, right? And coming to the skin, in case of skin we have two types of glands. So skin has two types of glands. One are called the sweat glands, and another one are called sebaceous glands. Sweat glands and sebaceous glands. Coming to these sweat glands, we know the sweat glands will produce sweat, whereas the sebaceous glands will produce sebum. So sweat glands produce sweat, and sebaceous glands produce the sebum, right? So the sweat glands not only they produce of course that sweat. So in that sweat there will be a lot of materials that are not required by the body. So this sweat is a watery fluid, and this watery fluid will contain, so it contains sodium chloride, okay, and also it will contain small amounts of urea is also present in the sweat. Then we also see the presence of lactic acid, etc. Substances that are not required by the body will be excreted out. Then actually the primary function of the sweat is to produce the cooling effect on the body surface, and the secondary function is the removal of some wastes which I have mentioned here. Then coming to the sebaceous glands, which I told that the sebaceous glands produce sebum, and this sebum will contain substances like sterols. I'll just mention here the sebum. It contains substances like sterols, and also it consists of hydrocarbons and also waxes, right? So these substances are excreted out through the sebum. So actually the sebum has a function, that is it gives a protective oily covering for the skin, okay. And not only this, other than these organs, lungs, liver and skin, okay, the saliva, of course it's not an organ, but the saliva also eliminates small amounts of nitrogenous wastes. So we know that saliva is produced by salivary glands. That saliva may also contain small amounts of nitrogenous wastes, okay. So this is how, okay, other organs that play a role in elimination of excretory wastes. Okay, fine. So with this we finish off the role of other organs in excretion. So now let's say the last part of the chapter, the disorders of the excretory system. So let's say about disorders of excretory system. So coming to this disorders of the excretory system, we will see about renal failure or kidney failure, okay, and then we will also see about renal calculi and also nephritis. Okay, so first we'll begin with this renal calculi. We'll start with the renal failure, or also called kidney, okay, failure. So is a condition when both kidneys stop functioning. So here one kidney is enough for the survival of the person, but if both the kidneys stop functioning, then what happens is the urea that has to be separated from the blood, it remains in the blood, and okay, it results in accumulation of urea in the blood. So when both kidneys stop functioning, so there will be accumulation of urea in the blood, and this condition, that is accumulation of urea in the blood, is a condition called uremia. is a condition called uremia, and this can interfere with several metabolic activities of the cell, and if it is not removed, then it can result in the death of the person. So the remedy for this kidney failure or renal failure is to replace the kidneys from the donor person, or we have to go for a process called dialysis. So here there are two things that we can do when a person have renal failure or kidney failure. So one will be dialysis, and another one is kidney replacement. So these are the two things that we can do in case where the kidney failure takes place. Of course, I'm talking when both the kidneys are not working. So if one kidney is still good and working, the other kidney that is not working can be removed, and the person can live normally throughout his or her life with one kidney. Here, these renal failures can be acute or they can be chronic. So the renal failures can take place that you can call it acute renal failure, or it may be chronic renal failure. So chronic renal failure is a long-term condition in slowly as the time progresses, the kidneys stop working in course of time. That's a chronic renal failure. Acute is within a short period of time. This acute renal failure we can identify with certain symptoms like what you call the oliguria, which means there is a reduced urine output which will be less than 400 ml per day, right? And then there will be increased creatinine levels. So creatinine is again an excretory waste that has to be eliminated. Okay, and then there may be the persons may have nausea, the back pain, and edema, which means accumulation of body fluids, and as a result the body starts swelling, and there will be even drowsiness in the case of acute renal failure. And coming to this chronic renal failure, the person again shows oliguria, then there may be weakness and loss of appetite, right? And vomiting, there may be headache, okay, anemia, then there will be low albumin levels in the blood. Even the edema condition can also be observed in chronic renal failure, okay. And even there may be hypertension and increased susceptibility to infections because of decreased immune system. Now I told you that this kidney renal failure, whether it is acute renal failure or in case of chronic renal failure, we can go for two things. One, to go for dialysis, and another one a kidney replacement. So this dialysis is a temporary till the person gets a functioning kidney from the donor. So till he gets the donor, a person have to go for the dialysis, right? Now let's see how this dialysis is performed. Right. So here the dialysis actually is of two types. One we call it hemodialysis, and another one called continuous ambulatory peritoneal dialysis. So dialysis is of two types, hemodialysis dialysis, and another one called continuous, okay, right, there is continuous, right, ambulatory, okay, peritoneal dialysis. So here the continuous ambulatory peritoneal dialysis is what we call in short CAPD. So first we will discuss about hemodialysis, how they are going to perform. Okay, hemodialysis. So here in a hemodialysis there will be a machine, okay, what we call it a dialyzer. So a machine, okay, dialyzer. Right. So the person's blood vessels will be connected to the dialyzer, and inside this dialyzer we find, okay, I'll take, so inside the dialyzer you may find, right, a series of interconnected, I mean, tubes, and these tubes are made up of, right, a material, what we call it a cellophane. So this is cellophane material, okay, and this dialyzer is filled with a solution, so we call it okay, the dialyzing solution. So it's all filled with, so dialyzing solution. So from here they are going to put fresh dialyzing solution, and this is a point from where, okay, they are going to collect used dialyzing solution. So this is used dialyzing solution. So this used dialyzing, this dialyzing solution, that is fresh dialyzing solution, it consists of some useful materials, except that excretory wastes like urea and all. And the, okay, when the blood flows through these cellophane tubes, okay, the urea will get actually diffused into this dialyzing solution, and some materials that are useful may get into the blood circulation, right. So from patient's forearm they are going to take locate a convenient artery, okay, so the patient's artery, so the patient's artery will be connected to, okay, at this point. So the blood from this artery will flow through the, okay, channels of cellophane tape, of course, that will actually act as a, right, semi-permeable membrane and results in exchange of the waste materials with the dialyzing solution. So you can see here the blood flowing through the tubes of cellophane, and okay uh, and finally the one end of this tube, it will be connected back to, okay, patient's vein. So connected to that patient's vein. Now here before this blood that is supplied into this dialyzer, they are going to add an anticoagulant substance called heparin. So heparin is an anticoagulant substance that prevents the coagulation of blood, okay, at any point, so that there is a smooth flow and back the blood into the patient's right body. So if there are any clots, then it can be dangerous to the person, okay, who is under this okay, dialysis. So this is how the hemodialysis is performed for a person who have renal failure. And here you can also call this dialyzer as a artificial kidney. So you can use one more word, or artificial kidney. Okay, right. So here from the patient's artery, the blood will be pumped into the artificial kidney. Just before, okay, pumping into it, they are going to add this heparin. So heparin is anticoagulant substance. Is anticoagulant substance, and the blood flows through, okay, the tubes that are having this cellophane, and this will act as a selectively permeable and will help in right removal of the waste. So here the urea, okay, will enter into the dialyzing solution. Okay, and the blood that is removed with the urea will return back to the patient's body. So this is the hemodialysis. Then next we'll see about a continuous ambulatory peritoneal dialysis. So the next one is continuous ambulatory peritoneal dialysis. Okay, so I told it's a CAPD. So what happens in this case, that dialyzing solution, they are going to directly, okay, inject into the abdominal cavity. So dialyzing solution is injected into abdominal cavity. So where, okay, in this when you put this dialyzing solution into the abdominal cavity, so the urea present in the blood may diffuse into the dialyzing solution, okay, present in the abdominal cavity. So the person in this case need not stay in the hospital. In case of hemodialysis, the person have to okay, stay in the hospital for, okay, 4 or 5 hours till that process is completed, okay, and then he has to go, okay, for every few days for this performing dialysis. In case of CAPD, what they're going to do, they're going to inject this dialyzing solution into the abdominal cavity, and the person can go, okay, to anywhere, do his all work, and after few days he again returns to the hospital where they will be removing this dialyzing solution and again filling up with a fresh dialyzing solution. Okay, right. So usually around 2 liters of dialysate is introduced into the patient's abdominal cavity with the help of a catheter. Okay, and it will be left for about 6 hours. And after 6 hours, the fluid is removed from the patient, and okay, the process will be again fresh dialysate will be injected, okay, into the patient's abdominal cavity. Uh, that's a difference between the CAPD and hemodialysis. Okay. In case of CAPD, there is one risk that the patient may get infection and inflammation of the peritoneum. The condition is called peritonitis. Okay, then the patient has to be given that peritonitis has to be decreased. For that, the patient will be given with antibiotics. So this processes they have to continue till the person is replaced with that failed kidneys with normal functioning kidneys. So that's about the two types of dialysis, hemodialysis and continuous ambulatory dialysis. So next we'll see about renal calculi. The next one are renal, okay, calculi. Right, so these renal calculi, I can simply call them as also kidney stones. So that kidney stones, okay. So these stones can form, okay, anywhere, I mean in the kidneys, especially in case of minor calyces, major calyces, or in the renal pelvis, or okay, they may form even in the ureters also. So now let's look at the kidney stones, that is renal, okay, calculi. So here, so this renal calculi is mainly means the kidney stones are mainly formed due to this high salt intake. So first we'll see the causes of kidney stones. Causes of kidney stones. So that is one, high salt intake. Then maybe low intake of water. Okay, not maybe, so low intake of water. Then there are certain conditions like parathyroidism. So in which what happens, there will be high blood calcium level. In parathyroidism there is high blood calcium level. So this high calcium can result in getting deposited and form or may combine with oxalates and form calcium oxalates or calcium phosphates, and that will result in the formation of kidney stones here. Right, so now let's see the symptoms of these kidney stones. So one, there will be hematuria. Okay, so hematuria is a condition where you will see, okay, blood in the urine. So excretion of those blood or blood clots in urine. I'll simply say blood in urine. The condition is called hematuria. Then there will be difficulty in passing urine. So there will be pain when passing the urine, that is the thing here, and the person may have okay, severe pain in abdomen. So he may also have, okay, the pain that spreads to the groin and also to genitals, and there will be, okay, nausea and vomiting conditions can also be seen, right? Now, what is the cure for this renal calculi? Okay, so the renal calculi can be treated with some drugs in the initial stages. If they are if the stones did not if the stones doesn't dissolve with the initial or with the initial drugs, okay, then the most efficient and safe method is laser lithotripsy. So they follow laser lithotripsy. In the laser lithotripsy, okay, they're going to fragment the stones and then remove from, okay, and from the kidneys or from the renal, okay, pelvis, or from the ureters. That is a laser lithotripsy. So in the initial stages, they will try with some medications to dissolve those stones. If it doesn't happen, then they go for this laser lithotripsy. Now, how to prevent these kidney stones is the person have to drink 2 to 3 liters of water every day, okay, and then the person should avoid calcium based okay, dairy products or even antacids, and the person should avoid, okay, spinach to avoid those oxalate stones. And so these are some preventive measures that person have to follow here, okay. So here, right, in this renal calculi, okay, as I said, there will be pain, okay. When these renal calculi are actually descending, means passing down the ureter by peristalsis, there will be a pain, and that pain we call it dysuria. It's called, okay, dysuria. And the if those kidney stones completely block the ureters, and it can result in another condition called anuria, which means no urination. So there will be no urination, and completely, okay, the urine gets blocked, okay. So then this can actually result in hemorrhage within the ureter, and will lead to loss of blood in urine. That's what earlier we have seen, the condition called hematuria, okay. This is small information on renal calculi. Of course, the formation of renal calculi will take, okay, period, so it may be in months or years, the time period required for the formation of renal calculi. Then coming to the third one, I'll see is about nephritis. So there are two types of nephritis. One is glomerular nephritis, and another one pyelonephritis. Okay, so coming to this glomerular nephritis, we can say this is an autoimmune disorder. It's an autoimmune, okay, disorder. So in which the endothelium, okay, of glomerular capillaries will become inflamed and they get damaged, okay. So this disease slowly progresses, and in course of time many glomeruli will get damaged, so, okay, resulting in chronic renal failure. Then coming to this pyelonephritis, this is usually caused by E. coli. So this E. coli usually it lives in large intestine, and sometimes okay, it may gain entry into the ureters and then into the kidneys, so causing the urinary tract infections here. Okay, and in course of time it can damage the glomeruli, okay, of these nephrons, and finally in course of time it can result in kidney failure. So that's about the nephritis, which is of two types, glomerular and pyelonephritis. Okay, fine. Right. Of course, if the kidneys fail, then the person have to go for the same, either hemodialysis or continuous ambulatory peritoneal dialysis. So with this, we have completed the synopsis. In the next session, we'll start with the objective on excretory products and their elimination.